Cardiovascular disease is the number one cause of death in men and women today, but this is not new news to you. What might be news is that cholesterol is one of the most inaccurate ways of measuring your risk of cardiovascular disease. Yes, that is what we use as our go-to test to see if we are at risk for heart disease. These are the startling facts I share with my private nutrition clients to ensure that they don't have this false hope that everything is great with their heart because their cholesterol test says so. What I'm going to share with you is why cholesterol tests are not what we should be using to evaluate our risk for heart disease. Did you know that 1 out of every 4 deaths in America is related to heart disease? That means between you and 3 people you know, statistically, 1 of you will die from a cardiovascular related condition. By now, you may be asking how to prevent becoming the next heart disease statistic. Symptoms won't tell you a thing. There are virtually no symptoms of high blood pressure, atherosclerosis, or coronary artery disease. In fact, for 1 out of every 3 people, sudden death is the first sign of heart disease. According to studies, 50% of people who have had a heart attack had normal total cholesterol levels. Even worse, additional studies showed that 75% of heart attack victims had low LDL, bad cholesterol levels. With numbers like that, testing cholesterol levels is basically a waste of time and money. Fortunately, there are better lab tests to evaluate your risk of becoming a statistic. However, your doctor has likely not heard of all these tests, and you'll have to request them. So here's what you need to do to reduce your risk for heart disease. Click the button right now, and on the next page, you're going to sign up for the webinar where I'm going to share with you all 5 blood tests. I will go into detail on each blood test and what each one is measuring to ensure you have the complete picture of any heart disease risk. One of these tests can actually tell you if you've had an inherited risk factor for heart disease. Click the button now to learn which test you need to ask your doctor to order.